Thank you for staying with us for the news. Let's get into our first story now. Despite government's many promises of ensuring floods do not continue to wreak havoc in flood-prone areas, some persons say they live in fear at the gathering of the rain because every drop in their vicinity results in a flood, affecting their property and health, apart from their emotional torture they endure until the waters reside. Hannah Odame has been speaking to them in our feature series titled Floods of Trauma.
The problem is that of poor drainage in our towns and cities, which leads to flooding during the rainy season. It is time to deal with these long-term problems and find long-lasting solutions, and we're doing just that.
This sound of rain and its accompanying breeze sends many to sleep, snuggling safely and comfortably in a firm textured bed. For others, however, it is an announcement of despair.
Because these days, when it rains just between 2 to 3 hours, then we get afraid.
This has been Irama's fear for years. The gathering of the clouds does not bring she and her family any joy. They rather experience fright, confusion, and palpitation.
It is very painful. I must tell you how I honestly feel about this situation. When it begins to rain around 5 p.m. and continues till around 8 p.m., we all get anxious. We get scared even to put our heads on our beds. And yet we are helpless because we seem not to have any solution. All we can do is to watch the rains drain into our rooms.
An occupational hygienist, Dr. Roland Srebo, talks about the health hazards associated with the floods and dampness that Irama and others who are in similar situations are susceptible to.
And sometimes after the flood has receded, the damp environment can also promote allergic reaction that can easily promote asthmatic attack. So in effect, these are some of the things that flooding can cause. And let's not forget, malaria is also knocking on our doors after flooding, because after flooding we realize that there may be stagnant waters within our community, and this can promote the breeding of mosquitoes, and we know the mosquitoes are the vectors of malaria, so by so doing malaria infection can increase during this time of flooding.
But Irama, who was born in this house, cannot move out. Her source of livelihood was mainly from renting these 14 separate room apartments to tenants. That is no longer an option because her income has greatly dwindled, with no one accepting to rent a house which gets flooded every time it rains.
Look behind me. I have lots of empty rooms which I could have rented, so I would earn some income. But I cannot do so because the rainwaters come in and destroy all the property of tenants. I have 2 rooms with a hall. I have self-contained. I have about 6 single rooms with each having its porch. They are all empty. Imagine how much I would have been earning from these empty rooms if I was renting them out. Yet, all these rooms are locked because of the rain. Recently, someone came to rent this particular one, but the rains destroyed all his things, so he left. It is really depressing, but there's nothing much we can do about it.
Irama is concerned about the hazardous impacts of the floods on her children and grandchildren, the mental torture, the inconvenience, and the health implications.
Just see these holes in the walls. We created them so that the rainwaters which enters our rooms can seep out through them. By the time I finish that work, I would be so tired. Sometimes, even after 3 days, we will still be collecting rainwater from our rooms. The rain seeps down into the ground. So each time we collect water on the surface, the ones beneath the ground then comes up. We keep collecting, so we don't see water anymore.
Acknowledging that not all of Irama's concerns will be immediately addressed, Dr. Srebo believes some of these measures put in place can at least mitigate the impact of the floods on their health.
We need to leave our compound greened. Why am I saying that? Because it's a fashion now for people to concrete their compound. By so doing, the water does not get space to drain or go into the soil. When the compounds are green and left nicely green, when it rains, some of the water will sink down and it may prevent a lot of them going. Because when we concrete our houses, our homes, it means that the water that's coming from our home is going to add up to other person's own, and at the end of the day, that is what can result in flood. And we should also try as much as possible not to build on waterway.
From the Kwame Nkrumah Circle, I am Hannah Odami for Joy News.
Now, according to the International Institute for Environment and Development, women farmers in Ghana constitute nearly half of the country's crop producers. However, they battle with a myriad of challenges, including a lack of land ownership, limited access to financing, among others. With the accelerated use of artificial intelligence in agriculture, the Gender and Inclusivity Officer of the Responsible Artificial Intelligence Lab, Dr. Rita Udo, anticipates a worsening situation. She is therefore warning of female exclusion with the use of artificial intelligence in the agricultural sector.
Speaking at the Africa AI conference in Kigali, Rwanda, Dr. Udo reviewed her outfit has put in place measures to ensure optimum female representation, especially AI in agriculture.
There is this inequality within almost every sector in our country, and the agriculture sector is one of the sectors where we experience a lot of gender inequality. So with the introduction of AI, we expect that it's not going to widen the already existing inequality within the sector. We want to see AI benefiting all individuals within the sector. And how do we do that? We want to make sure that we think about artificial intelligence, or we think about gender right from the designing, the data collection, the implementation, and all that. And so at REAL, we always think about gender. We want to know who is behind the data collection, who is behind the modeling. We want people to be aware of themselves, because if you have some biasness or some stereotypes, you are more likely to introduce it into whatever model that you are designing.
Reporting for Joy News, Kwesi Deborah.
In our next story, the Techima North District Director of Health, Jacob Monokwa, is worried about the low number of healthcare facilities in the area, with the district's 106,000 population currently without a doctor. He made this revelation during a brief ceremony to mark the 5th anniversary of the Zunuo Hospital, the only private hospital in the district. Anas Abid has more in this report.
The Techima North District, with an estimated population of 106,000, currently has 15 health facilities, 12 Ghana Health Service and 3 private facilities. Even though these facilities scattered across the district are doing well in terms of providing healthcare delivery to the over 64 communities in the area, the number is woefully inadequate considering the population of the district. Jacob Monokwa is the District Director of Health Services.
We need more with our population and the facility that we have. We don't want people traveling some maybe more than 5-6 kilometers to render service. So the facilities that we have, we will say they are not enough when you look at our population.
Last time I checked, the entire district don't have a doctor. What is the doctor population ratio?
Doctor population ratio is 0 to 1,000, 106,000. Our population is 106,000, and we don't have doctors, so it's 0 to 1,000, 106,000. That's our population.
Today, the only hospital serving the entire district, Zunio Hospital, a private healthcare provider, is 5 years old. Chief Executive Officer of the facility, Dr. Zimbla Emmanuel, says the facility's motive is to provide quality healthcare to the people of the area, particularly the less privileged.
Zuno became a health facility 5 years ago. We started as a clinic. About 2 years ago, we got the accreditation as a hospital. That is so fast if you know how the system works, that we have been able to upgrade from a clinic to a hospital within 3 years. And that tells you that our services have been appreciated. We have been able to upgrade the facility, not just in equipment and human resource, but also in quality healthcare delivery. From a client base of about 15, 20 a few years back, now we are having an average of 100 clientele per day. And that tells you that we have really come far. We have really succeeded in our vision.
The facility's biggest challenge over the years, however, is finance, with reimbursement from the NHIA always in delay.
It has always been finance. Reimbursement from NHIA, low tariffs. That has been our biggest challenge. If we were getting regular reimbursement from NHIA, I think the system could, and maybe realistic tariffs. Yes, that could propel us up.
Chairman of the occasion and Dabenhene of the Techiman Traditional Council, Nana Osu Anchibusi Akon II, called on government to extend support to private health facilities in the area as they augment government's efforts in providing healthcare to the people.
You know, private facilities, their strength alone will not be able to meet the standard. You always need government support from every angle. At times, there should be a waiver on other things, drugs and other equipment, just to augment their support. At the same time, if there are other drugs that government can even give them free to them to support whatever they are doing, I don't think it's a bad news at all. We need the support. We need the taxes on their products to go down so that they will be able to support and also take part of the government responsibility. That one will only happen when the people or patients attending to these hospitals, their bills go down. And all this will happen when government also comes in to waive other things for them. Then it will be a relief.
The team, led by the CEO of Zunio Hospital, cut a sword for the construction of an ultra-modern hospital in the area to serve as a backbone to quality healthcare delivery across the district. Anna Sabit, Joy News, Techiman North.
Now, the Pro-Vice Chancellor of the Simon Diedong Dombo University of Business and Integrated Development Studies, Professor Emmanuel Derebele, has stated that for Ghana to solve its unemployment challenge, technical and vocational institutions in the country need to develop training modules that are relevant for the jobs on the global market. Professor Derebele made the statement at the 50th anniversary celebration of the St. Basilides Technical and Vocational Institute at Kaleo in the Upper West region. Rafiq Salam reports.
Speaking on the theme, harnessing technical and vocational education for the holistic development of the Ghanaian child, Pro-Vice Chancellor of the Simon Diedong Dombo University of Business and Integrated Development Studies, UBEDS, Professor Emmanuel Derebele averred that the 20% unemployment rate in the country, using figures from the 2021 population and housing census, poses a serious threat to the security of the country. Comparing employment rates in Africa, Europe, and the Americas, he stated that whereas the youth in Africa lack adequate training opportunities and face unemployment, in Europe and the Americas, they have training opportunities, but their numbers are extremely low and can't fill the existing jobs. Professor Derebele therefore noted that for products of technical and vocational training institutes in the country to fill in the void, they need to be provided with the relevant training that is required in the global market. He further stated that in the context of globalization, it is important to begin to pay attention to evolutions in digitization, computer-based application, and artificial intelligence in training.
These countries are deploying technology and artificial intelligence, but they still need people to sustain their economies. The implication of the context I have provided is that the current and future cohort of students that you are training and will be training are global citizens. For you to provide relevant vocational and technical education for the holistic development of the Ghanaian child, it must be the kind of training that prepares them for placement in the global job market.
Member of Parliament for Nadoli Keleu, Anthony Munkarasoma, calls on authorities of the St. Basil's Technical and Vocational Institute to bring their expertise to bear on the people by organizing short programs to enable them acquire employable skills.
That you can bring your skill to bear on the people of this constituency by organizing short programs so that people can acquire some skills, employable skills. And secondly, to also assist those who are already in the trade so that they can upgrade their skills. One key thing the guest speaker talked about was technological evolution, digital evolution. You need to lead that. Things cannot continue to be the same. So our people are being priced out of the market, not just by price, but because they lack some skill. And I'm looking forward to working with you on that.
The St. Basil's Technical and Vocational Institute was established in 1973 by three brothers, John Van Wyden, Henry Shaws, and Jose Vimdenta, and since then has shown several successes, including churning out sea of graduates who are working in various fields of the country's development. That feat, according to the principal of the institute, Reverend Brother Fabian Basil, however, was not achieved without challenges emanating from the increasing student population. Key among them are inadequate food supplied to the school by the buffer stock company, inadequate classroom blocks and space at the dining hall, forcing the students to eat under trees, and lack of a library facility for the school. Reverend Brother Fabian appeals to the government for a quick fix of the challenges.
They sit on the trees to eat. We have converted one of our carpentry workshops into a dining hall, but it is too small for 1,000 students. It cannot even contain 500. So they just go in there to serve the food, and then they sit on the trees to eat for now. But the dining hall contractor, who is at the moment on site, is promising that he will work hard and then complete the project for us. But it all depends on funds, because it's a huge project. It was more or less roofed. Ceiling joists were fixed and was ready for plastering. Unfortunately, it collapsed. We don't have a library at all. We're using a small place as a library. Now, last year, Ministry of Education sent a team to find out from us whether we have a space for them to install computers for us. We could not have said no. So we decided that the small space that we're using as a library, we will use that as a computer lab. And we are then counting on Divine Providence to help us get at least a standard library where our students can comfortably carry out their studies.
Representing the Upper Social Minister at the function was the Nadolo Keleo District Chief Executive, Catherine Lankono.
Technical vocational education and training remains our best bet if we really want to win the fight against poverty as a nation. Let us embrace TVET and equip our youth with the relevant skills that are readily sought on the job market.
Reporting for Joy News, Rafik Salam, Keleo.
And on that educational note, we cap off the news, but stay with us. Up next, we get into the news review. We'll be right back.